Hello, I'm urologist Omer Erdamakaya. Today I'm going to give a short video presentation to you about testosterone enanthate and its harms. Testosterone enanthate is one of the most prescribed products in the world for testosterone replacement treatment or anabolic use. It is a very old product. It has 50-year-old brands. Bayern's Testaviron in Europe and Dilatestrol in America have been sold for about 50 years. With enanthic acid coming to the 17th ring of testosterone, this ester takes a slow-release position. The half-life in the body is about 7 days. In this graph we see how testosterone fluctuates after using testosterone enanthate. It peaks on the 2nd day, comes to basal level on the 10th day, meaning it comes to the first level, and in the other 20 days testosterone can finally recover itself. Here in the next graph, we can see the blood levels when testosterone enanthate is used with weekly doses. When 250 mg of testosterone enanthate is used weekly, it goes above physiological doses, but when 2-week doses are applied, it is possible to catch physiological doses as shown in the graph here. Regarding the harms of testosterone enanthate, if we look at the androgenic side effects of testosterone enanthate, hair loss, oily skin, acne, prostatism problems, especially due to 5-alpha reductase activity, these may vary from person to person. However, if we look at the estrogenic side effects, water retention in the body is common. There may be fat due to estrogenic effect, and gynecomastia is one of the side effects we expect. It has no hepatic effect, meaning serious side effects on the liver. Of course I'm talking for physiological doses. From a cardiovascular perspective, it can cause hypertension, left heart enlargement, and may cause changes in serum lipids. We do not expect a serious effect in serum lipids at physiological doses. While there is no serious problem with 300 mg weekly doses, it can cause trouble at doses of 600 mg. There it can raise LDL in lipid metabolism. Especially if the patient uses an aromatase inhibitor together with enanthate, the lipid profile here may be adversely affected in a more serious way. However, it has testicular side effects. In long-term use, not like 6 to 12 weeks of use, but long-term use, shrinkage in the testicles, and deterioration in sperm quality may appear. In 6 to 12 weeks of use, testicular side effects remain with deterioration in sperm quality, but in longer use, testicles may shrink. There is also a hypogonadal side effect. If we look at the hypogonadal side effect, as shown in the graph here, in the post-cycle period, that is, after the first week of testosterone enanthate use after anabolic cures, LH only recovers at 18 weeks, while testosterone also recovers at 18 weeks. During this post-cycle period, testosterone remains low for around 4 months. During this period the patient can of course suffer from problems. During this period, usually anabolic users do post-cycle treatment using Clomid or HCG. Here, in fact, one of the most important problems in testosterone enanthate is the counterfeiting of testosterone enanthate worldwide, and its production in unsuitable conditions in underground labs and sale in black markets. Those have heavy metal residues in it. It's not easy to find original testosterone enanthate and it's expensive when available. Those of course create a serious problem for anabolic users. In this regard, they even made test kits to test the drug bought at home in Europe or America. It's called Roid test. I may talk about this in my next video. Thank you for listening. Best regards.